Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. Today, we will be reviewing infection prevention and control resources that are available from the CDC's Project Firstline and West Virginia Project Firstline. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Everyone has entered today's meeting on mute, but we will have a discussion at the end of this webinar. So if you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. You can also raise your hand to request to be unmuted to ask your question out loud. And before we get started, I have a couple quick items to share. First is about a questionnaire that we are conducting right now. As some of you know, we're working with nursing homes to raise completion of CMS's targeted COVID-19 training for frontline nursing home staff and nursing home management. And we've heard from some of our nursing homes that there have been challenges with completing this training. So we've been working on some alternatives. And here's how you can help us. We have made a quick questionnaire about the CMS training and other types of training that you might be conducting in your facility. And we ask that if you have not already answered this questionnaire, to please take a few minutes to fill it out following today's webinar. And I will share the link for that in the chat shortly. And the second item is I want to invite everyone to next week's webinar, which will be a special hour-long presentation called A Deep Dive into Adverse Drug Events. And that will be with Dr. Jean Storm. And that webinar will be eligible for continuing education credits for nursing. So if you're interested in attending or learning more, I'll drop another link in the chat shortly with more information on the CEs and how to register. And that webinar will be this time next week, Wednesday, April 12th at 2 p.m. And now I'd like to introduce our guest today, Joni Price. Joni is a registered nurse and education manager for West Virginia Project Firstline with the State Department of Health and Human Resources. She received her associates in nursing in 2009 from the University of Charleston and began her career as a pediatric nurse at Logan Regional Medical Center. She has worked in public health since 2013, when she began working for the West Virginia Breast and Cervical Cancer Screening Program, and she has worked as Project Firstline's education manager for DHHR since November of last year. Joni, thank you for joining us today.
Thank you. So we can move to the next slide already. So like she said, I'm Joni Price, registered nurse for Healthcare Associated Infection and Education Manager for the Project Firstline Infection Control and Prevention Program within Division of Infectious Disease. The objectives for today's presentation are to define the purpose of Project Firstline, identify target audience of Project Firstline, and identify partners working with Project Firstline. To stop the spread of infectious disease threats, anyone working in a healthcare facility needs a foundational knowledge of infection control and must understand and be ready to implement infection control protocols and procedures throughout their workday, including during every patient care activity and healthcare interaction. So Project Firstline is the collaborative of diverse healthcare and public health partners that aim to provide engaging, innovative, and effective infection control training to more than 6 million healthcare personnel in the United States, as well as members of the public health workforce. So what are the goals of Project Firstline? So Project Firstline will provide every person working in the U.S. healthcare facility the foundational understanding of infection control and protection, and to protect the nation from infectious disease threats, such as COVID-19, aims to provide a foundational and practical knowledge directly to all frontline healthcare personnel and targeted components of the public health workforce. And the focus of the curriculum is infection control basics, such as transmission risk, safe donning and doffing of PPE, and with an emphasis on preventing the spread of respiratory infections. So to build a foundation of IPC knowledge and a culture of IPC expertise in the healthcare community in order to keep healthcare personnel safe and prevent spread in healthcare facilities. So Project Firstline will reach healthcare workers in all healthcare settings, including our hospitals, outpatient clinics, dialysis centers, nursing homes, our local health departments, and our vocational schools, our high school students that are in vocational schools in allied health settings. Project Firstline is not only geared toward frontline healthcare workers, our local health department nurses and epidemiologists will also benefit by having access to additional resources for facilities and active outbreaks, gaining prevention resources for staff and communities during clinics or community outreach events, and just overall gaining additional knowledge in the IPC practices. Because of course, infection control saves lives and all healthcare workers play a critical role. So Project Firstline activities, and we have a lot that we're actually in the process now of gathering, and we'll be sending out information and letting everybody know what we do have coming up here in the next year or so. But the activities associated with Project Firstline include we establishing local and regional IPC training and education expertise, conducting high-level learning needs assessments of West Virginia's healthcare workforce to identify training gaps, promoting awareness and facilitating uptake of infection prevention and control training and education content, which may include curriculum development by the CDC or approved by CDC as part of the broader Project Firstline initiative. So conducting and convening trainings for frontline care providers, which may include establishment and implementation of remote learning capabilities. The Project Firstline training, together, the collaborative will provide millions of frontline healthcare workers and members of the public health workforce the infection control training they need to protect the nation from infectious disease threats. Project Firstline trainings are accessible, so no matter your previous training or educational background, you'll be able to understand each video, concise, to fit around a busy schedule. Each video lasts approximately 10 minutes. And I think that might even just be the longest one. They're anywhere from a minute to 8 minutes. I think there's just a couple that are about 10. And it's interactive. So to keep you engaged, each video has built-in knowledge checks. Trainings designed for Project Firstline have specific features that include core training to address immediate workforce infection control training needs, delivered via short and accessible training videos, the practical tools to support everyone working in a healthcare facility as they implement infection control protocols and procedures throughout their workday. Partner engagement to share information across all healthcare settings through trusted partners and channels, ensuring that training content and tools are delivered to healthcare workers who need them. Mentorships to connect infection control experts with local healthcare communities so they may become an ongoing resource. Our public health technical capacity building, that's to leverage the public health workforce to facilitate knowledge and tool sharing between public health departments and local clinical communities. The innovation to deepen the knowledge to better inform infection control recommendations and to develop innovative platforms and content to provide infection control training to a diverse range of adult learners. So what makes Project Firstline unique? It listens to healthcare workers. The resources have been developed with healthcare workers, specifically for healthcare workers. Content is accessible to all healthcare workers, regardless of previous training or background knowledge, because it appreciates the value of every healthcare worker and the role they play in infection control. And all healthcare workers play that role, all the way from your housekeeping, maintenance, cafeteria workers, to our nurses, our physicians, just everyone. Project Firstline recognizes that the bandwidth is low due to burnout and trauma. I mean, we have had a pretty rough couple of last years or so. So the bite-sized content is tailored for practice and on-the-go use and is designed to be integrated into the workday. Meets healthcare workers where they are, taps into intrinsic work-related motivations, leverages existing strengths and knowledge sources, teaches the why behind infection control recommendations as much as the what and how. Committed to healthcare equity. So education resources and dissemination methods are tailored for the diverse healthcare workforce, including transitions for those who speak Spanish and multiple Asian languages. So here we have the CDC Project Firstline website, and I have the website also is listed at the bottom. This is the website where you'll be going to find all of the Project Firstline resources needed to lead successful infection control sessions. And we'll be showing the website again, at the end of the presentation. Next slide. The Project Firstline resources, and there are so many, and it's just a great plethora of information and tools to use for your training. So this website gives you access to all of the Project Firstline information. It's the educational materials, training resources. They're in a large variety of formats, specific infection control measures to protect against COVID-19 and more. So learning about infection control in healthcare, Project Firstline Infection Control Training Series is a series of 6 sessions. They're already prepared with slides and created in 20-minute settings. The sessions are geared toward recognizing infection risk in healthcare and learn where germs live in healthcare. There are also great educational materials that are associated with these sessions. There are a lot of fact sheets that are available for printing, and also a few interactive tools. Next slide. So infection control training toolkits, and these toolkits are super fabulous. They have everything ready for you. So the infection control training toolkits have pre-made, ready to use facilitator toolkit guides, your feedback forms, the self-assessment forms, complete session plans, full set of PowerPoint slides, and also participant booklets. The infection control and COVID-19 sessions have sessions available in 60 and 20 and 10-minute training options, all with prepared slides to accommodate each of those timeframes, and a participant booklet are for all sessions combined. The recognizing the risk using reservoir sessions slides are only prepared in 20-minute sessions, and as you can see here, the recognizing risk using reservoir training toolkit sessions that are prepared in 20-minute presentations. We have the what does it mean to recognize a risk, how germs make people sick, recognizing risk using reservoirs, which is a review. So the the third session in the recognizing risks using reservoirs sessions, they're reviews of the first and second. So infection control and COVID-19 sessions, these are the session topics for infection control and COVID-19 sessions, and the website to access them are at the bottom of the page. The recognizing risk sections, and these sessions they're in 2 different locations on the website. So that's why I included the websites on there. And it's also helpful if you get on the website and explore on your own. But the infection control and COVID-19 training toolkit sessions, they're prepared in 60, 20, and 10-minute presentations. And there's your concept of infection control, basic science of viruses, respiratory droplets spread COVID-19, how viruses spread from surfaces to people. There's a whole review of the spread of COVID-19. One of my favorites is the multi-dose files. Your PPE series, hand hygiene, there's several. Our Project Firstline Facilitator Toolkits, the Infection Control and COVID-19 Facilitator Toolkit Guide is provided to help with preparing and conducting your sessions. A lot of information in those toolkits, very helpful. There's an overview of Project Firstline, along with session plans, toolkit content, explanation of facilitator responsibilities, just instructions on building a session for specific time allotments. There's just full of, there's a lot of really great suggestions for preparation and delivery of your presentations. Next slide. So Project Firstline educational videos, these are great series of videos that you can combine in your presentations. A wide variety of educational resources to help with delivering a successful session. The videos help instruct about different infection control topics, such as the respiratory droplet, basics, and safe use of multi-dose files. These videos here are 1 minute to 5 minutes in length, and you can download them from YouTube or from the CDC website. Another series of videos, they're all led by CDC's Dr. Abby Carlton, and she is very funny. There are 24 videos in this particular series, and each of these videos go with each of the infection control and COVID-19 sessions. They're anywhere from 3 to 8 minutes long. And you can also view these series of videos from YouTube or CDC Project Firstline website. Promotional resources. There are a lot of promotional resources, all the way from printing to mailing, delivery, and social media. Project Firstline resources that they're here are your social media graphics that you can download and share on Twitter, Facebook, Instagram. And all of their graphics are really colorful. There are even backgrounds that you can put on your computer. They have a lot of great things. Next slide. Your print materials, Project Firstline. Printable learning aids, and here these that you see here are examples of the posters. They're all in a PDF format, easily downloaded for printing. See just how colorful, and they get straight to the facts. Project Firstline also has, in the printed materials category, the bright colored posters that have a delivery of very valid statements. Germs are indeed everywhere, and by doing our part together, we can protect our patients, communities, and ourselves in preventing the spread of these germs. They're also in a PDF format and easily downloaded for printing, and we're actually in the process right now of having more printed so we can actually get some out to a lot of our facilities. These are the infographic fact sheets loaded with information on all the Project Firstline topics and sessions. They can be printed and used as educational tools for your new hires, for your waiting rooms, even your break rooms. Just fun refreshers or reminders. So Project Firstline educational materials, these are the fun ones, the interactive resources. So you can check your infection control knowledge and gain feedback in real time with the interactive educational information or infection control resources. So here we have the diarrhea dilemma, fidgeting Felix gets an IV. And it's just to help understand how to apply basic infection control practices. So when unexpected challenges arise, you'll know how to respond to keep patients and yourself safe. And these interactive resources are a big hit during your trainings. Here's examples of the What's Wrong with This Picture series. Our healthcare workers, of course, need to be extra aware of where germs are found and how they can be spread to surfaces and people. So when we can recognize these risks for germs to spread, we can help stop infections. Here we have the emergency room, nurses station, and outpatient exam room settings. These interactive activities, they're great for getting all of your session participants involved in discussion. And I have found that they really, really enjoy these. Another interactive resource, this is the hugest hit. Understanding where germs live and how they spread. Also helps understanding the environmental infection control so that you can take action to protect your patients and yourself from the spread of germs. You will explore the different reservoirs of the human body and the healthcare environment to learn more about where germs are found and how they can spread. All you would do is just click on the purple dots, and then you'll be given the information to recognize common infection risk and understand the infection control actions that you can take to stop a spread. Next slide. So with the West Virginia Project Firstline training opportunities, we provide in-person, virtual training for healthcare facilities of all types of frontline healthcare workers. We also can do train the trainers for facilities, and that's what we consider is we'll train your facility how to do the trainings, and then you in turn would train your staff and just report back to us. Let us know how it went when you had your trainings. And they're great. They're great for in-services, and plus CMS actually now recognizes them, and you can get credit for your meeting your requirements. You would just contact me, Joni Price. And there's my number, 681-341-0496, or you can email me, joni.l.price@wv.gov. Upcoming events. So our training events for Project Firstline can be found on this website. This is the West Virginia website. And I will tell you, we are going to be having it under construction here in a couple of weeks or so, because we've got a whole new format that we're going to try to get laid out and be able to list more things and more upcoming events as we're scheduling them. Our references, of course, was the CDC, government infection control, Project Firstline, All About, which is where all your resources for Project Firstline will come from. And here's my contact information if you're interested in having a training done at your facility, or you would like to do a train the trainer so that you can pursue your own trainings for your staff. Does anybody have any questions?
Thank you, Joni. So if anyone has a question, please share them with us using the chat or the Q&A tool in your Zoom menu, or if you would like to ask your question out loud, you can raise your hand. And while I'm saying that, I need to pull my participants view back up. Now I can see you all. So if anybody has a question they want to ask out loud, you can raise your hand. While we wait, I'd again like to remind everyone about next week's webinar, which will be a special hour-long presentation on adverse drug events. So that will be this time next week, Wednesday at 2 p.m. And as I said earlier, that webinar will be eligible for continuing education credits for nursing. So if you're interested in learning more, I will put the link again for that webinar's flyer in the chat right now. We also invite you to join our virtual live chats, which are each Tuesday and Thursday at noon. If you have any questions about topics like quality improvement initiatives, infection control, or MDS coding, Deborah Wright or one of our other quality improvement specialists will be on that call. And can help you out with any questions that you might have. So those are each Tuesday and Thursday at noon. And if you're looking for the links to join any of our webinars or our office hours, we put those in our Friday newsletter, the Last Minute Lowdown. And if you're not on that mailing list yet, please contact me and I can get you on that list. My email is ccaudil@qualityinsights.org. Now, a question is, are the CEUs approved through NAB? So that would be for the next week's webinar, I'm guessing. Let's see, I'll pull up our flyer and see if it says where it's from.
Yeah, I'm pretty sure. I think that's the,
It says American
maybe, I
Nurse.
think that's administrative, and I think these are nursing CEUs.
Yes, it's nursing CEs. It says Quality Insights is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. So that's, hopefully that answers your question. Thank you. If anybody has any questions about today's webinar or Project Firstline or about our upcoming webinars, please let me know. And we're hoping to be able to share these slides later this week. We're waiting on some approval from higher up to be able to email them out. So if we get as soon as we do get approval, we can email those. And I will be emailing the recording for today's webinar later this week to everyone who is registered for today. Take another minute before we sign off for today. I don't think we've gotten any questions yet.
Thanks, Cheryl did put, yeah, NAB is the nursing home administrator. Thanks for confirming. We are looking at a webinar right now, but you know, those NAB credits take a little bit longer. So we're in the process of planning for a future webinar that we're hoping to get some of those credits. And we'll keep you updated. So keep watching. Keep joining these webinars, keep watching the Friday newsletter, and we'll make sure that you get that information.
Thanks, Penny. For those of you who don't know, Penny Imes is the head of our nursing home team here at Quality Insights. And for anyone who is here today with us today, who is from Pennsylvania, I know a lot of our nursing homes are in Pennsylvania. We had Jenny Bender, Pennsylvania Project Firstline on a few weeks ago. So if anyone would like to see the recording from that webinar to learn a little bit more about the Pennsylvania program, please let me know and I can send you that recording. Okay, I think we can go ahead and wrap up. As I said, I'll be emailing everyone later this week with the recording for this webinar and the contact information for Joni here in case anyone didn't get a chance to jot all this down. And if you have any questions, you can follow up with Joni or you can ask me and I can send your questions to people on our nursing home team. Okay, it looks like we can wrap up. Before we sign off, we'd like to ask everyone here to answer a short evaluation of today's webinar. This is not the same as the Q&A, the questionnaire that I put in the chat earlier. This one's just about today's webinar. And that evaluation is anonymous and will show us a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. I'd like to thank Joni Price for joining us here today. That was a wonderful presentation. Hope to have you back again sometime. And I'd like to thank all of you for joining us today, and we hope to see you all back here next week.